Today we have Dr. Shyamasundaran Kottilil, Maryland School of Medicine, Institute of Human Virology. Let us hear from the virologist the myths and the facts about corona or COVID-19. As a virologist, how do you assess the devastating situation of coronavirus, spreading deaths all over the world?
For specialists, this is not surprising. We have been predicting worse outcomes for viral pandemics for many years. We have seen this over time with the Spanish flu, the swine flu, then your H1N1 and the SARS epidemic in the many years. I think it's not surprising that it has been extremely highly transmissible. However, we are reassured that the mortality rate is not very high so far that reported. This fact really highlights that as a nation, globally, we are not prepared to deal with pandemics.
Let me ask you, what are the reasons for the uncontrollable spread of coronavirus?
There are three major reasons why we are dealing with this COVID pandemic. One, it's what we call as a zoonotic disease. That means infection has jumped from another species to human beings, and that's new. And we really have no immunity. That's the second reason, that we've never seen this infection before, so most people have very limited immunity for this particular disease. And the third reason is why it spread very quickly. That's because we have extremely modernized travel facilities these days. Right now, you can reach from one part of the world to another part of the world within 24 hours, anywhere you want. Even if you use travel restrictions, people can bypass travel restrictions from countries and get to the destination very easily. This has always been a concern, and we knew that a combination of three factors is a perfect setting for the global.
Could you please share the obstacles behind finding a suitable vaccine for COVID-19 or coronavirus?
Development of a vaccine is very easy. With the modern technology of sequencing, you can identify regions of the virus that could respond quite well when you create a vaccine against that particular region. However, we have to demonstrate that this particular vaccine is safe, and then it also have to be proved that it is efficacious in preventing infections in people. So making something from a computer versus proving it in patients takes time. It takes months and maybe years to develop that. That's a delay in developing the vaccine strategy for coronavirus. The other challenge that we think we may have to address is that if this coronavirus becomes seasonal, like influenza, then it can travel around the country and come back and undergo what you call as mutations. The changes in these regions that the vaccine is targeting could be problematic. We do not know that will happen yet, but that's something that we are concerned. Same thing is applicable to drugs. When you have new therapeutic drugs, when you give it to a patient, it's very difficult to figure out whether that particular drug is doing what it's supposed to do unless you compare that with the placebo or some other treatment arm. Right now, 95% of the people will have a good outcome. And because of that, you just don't know if they are all treated with some drug. They are recovered. Is it because of the drug or is it because of their natural history of the disease? And that's very difficult because the drugs do have toxicities, and hence we have to do large clinical trials, and those clinical trials will take time because they have to be compared to a placebo or some other treatment arm.
Can we augment general immune system? Can certain foods such as ginger, turmeric, honey make a difference?
In general, the immune system will wane over time as you age, and that has been documented. So there are a variety of different things that people take, the vitamins, etc., that are supposed to boost the immune system. Whether those things will protect against specific coronavirus infections is yet to be proved. However, that is not, it is generally advisable that you follow nutrients, good diet, exercise, and have the vitamins so that you are well nourished, your supplementation of vitamins are good. That always helpful your immune system. Specific immune responses against new infections and new pathogens are completely different. So sometimes they may protect, but it's not guaranteed that these will actually do protect. That's why we need a vaccine or a specific therapeutic agent to help you with this.
What does it mean when we say humans have not been exposed to this disease?
The reason we say that humans are not exposed with the disease is because this is an infection of animals, and they used to infect animals and create sickness in animals. And now what we have that is somehow it has adapted either through an intermediary host or without an intermediary host, jumped into humans, and now they started infecting humans. So that is why we are saying that we have not been exposed to this before, because we are not really in close contact to those exotic animals and those reservoirs of this viral infection up until now.
The death rate is as low as 2%. Why should we panic?
It is reassuring the death rate is not very high. Compared to like Nipah or Ebola, the death rate is about less than 2%, in some places less than 1%. However, if you look at mortality of certain subgroups of people, older men, and people who have comorbid diseases, obesity, diabetes, hypertension, etc., that numbers goes up to 20%. And the major challenge in the setting of this pandemic is that even someone who may not have symptomatic disease, may not kill themselves, they could bring those diseases to home to their loved ones or their neighbors or the people they interact with, and they could kill them. So it's more of an indirect effect. It's more equally or more significant than the direct effect of the epidemic.
China has almost arrested COVID-19. Why are other countries like Italy and US failing in this endeavor?
It is only time will tell whether which countries did better in the management of coronavirus. It appears that China has done a good job in controlling the epidemic. They have really enforced mandatory quarantines and really significant measures to control the epidemic, which may not be possible in many other democratic countries. And that's, as we have seen, many other countries have suffered because of the inefficiencies of lockdown, etc. I would say a place like Kerala is a better example of controlling the epidemic in a really coordinated fashion. And I believe that has happened because there is a huge political will, and the people great leadership, and the public health sector and the infrastructure is already there so that they can intervene and control the epidemic better than some of the other developed countries.
Besides corona, fungi fever, bird fever are also spreading. How do these originate?
Many of these viruses are host specific. They have natural hosts they actually infect and kill them. And they do not usually affect other cells because they may not have the right receptor or may not have the adaptability to infect other cell types. But when it jumps species, when the circumstances align and they can get introduced into human host, they develop mutations, and then they somehow some of these strains will develop the capability to binding to human cells and then infect human beings and diseases. And this has been shown in the laboratory. In a recent study in Netherlands, they took bird flu strains, and over multiple passages of bird flu, eventually the bird flu that was only infected birds then could infect human beings. And that's something that we were always concerned about. The frequency of that happens is very low, and hence that it doesn't happen every year.
Let me ask you another pertinent question. Can we rule out the advent of another fatal virus other than corona?
How do we protect against future epidemics? We have to block down wet farms. We really have to block the entry where pathogens can enter into human system. We have to have better control of vectors. That means mosquito control, bat control, etc. That for surveillance of these vectors, and it has to be done properly, and those type of research has to be supported so we can be better prepared for what we are up against in the next future. We also have to be good to the environment and protect and contribute ourselves to the global warming, so that will prevent the migratory pattern that also can introduce infections to the general public.
H1N1, chikungunya, SARS, Nipah, now corona. Recent years, we are seeing so many viruses coming in. According to you, what may be the reasons?
The major reasons for zoonotic diseases such as coronavirus is the multiple. So there is an increase in population leading to deforestation. That leads to the disturbances in the natural habitats of animals, and they come and they're more encountering with people. And this mainly happens when there is a population explosion, such as to Asia. And that's why one of the reasons we are seeing many of these things starting in countries like China and Asia and then spreading to other parts of the world. Global warming is another important factor. As to global warming, there is a difference in migratory pattern of birds and animals, and that's been a concern that will introduce new viruses and new pathogens into non-immune patient population. One of the examples is West Nile virus. West Nile virus is a mild disease in the Middle Eastern part of the world, but then when it was introduced in the Western world, it created a lot of problems, and it took a while for people to develop immunity and get better from that. So this is always a concern when you are introducing new infections through animals and birds that may be migrating because of global warming.
How can we keep the healthy future of the survivors of COVID-19? Could you please shed some lights on that?
When the sequelae among people who survive COVID-19 is yet to be established. We just gonna have to wait and see for long-term follow-up studies and what kind of sequelae these people have. That means the residual problems associated with surviving a COVID-19 infections. We have some hints now, but we just need to have a lot more data before we can speculate that there is a pattern of disease spectrum we may have. Sometimes we may not have, like people with influenza will recover eventually and they will do fine. So we just gonna have to wait and see whether there is a long-term impact. At the moment time, we don't really have clear evidence that there is long-term sequelae of coronavirus infection.
Lastly, but not least in importance, what is your perspective of an almost disease-free world?
What this pandemic teaches us is that how do we protect ourselves for future? So there are general things we have to emphasize. We have been talking about this for many years, which most of us don't do it clearly. So we have to be careful when you travel, careful with what you eat, not eat uncooked raw meat. Be careful when you take exotic food. Make sure you wash your hands. Make sure you take precautions when you're around sick people. Make sure that you use hand sanitizer or something that will protect you. Most of these infections actually come by contact or by droplet. So if you take those precautionary measures, you could avoid and protect yourself and sometimes other people around you by making this a routine practice rather than is implemented at time of a pandemic.